What FA tapes? Where? Hi guys, today I have on Miss Dr. Abigail Powell. So on Instagram, she is the aviation therapist, all things therapy and aviation. So do you just want to kind of like explain why people should trust you and like your knowledge of aviation?
Absolutely. I mean, of course I'm biased, so please trust me. But yeah, so I have a doctorate in clinical psychology, and I mean, I've been in the aviation field basically my entire life, being raised by a pilot. Yeah, my father's a pilot, so and now got 3 siblings who are pilots, and I guess I just didn't get the memo until way later after getting this doctorate. That aviation is the way to go. And so it's okay though, because my husband's now time building, and so he's kind of in the beginning stages of his aviation career. And so, I mean, I think that though it would be great to be able to know 100% what one would be feeling, thinking, while in the cockpit, especially inconsistent feelings that they may have while flying.
What are you thinking and feeling right now?
So it was really good because I was like, okay, is this dopamine or is this cortisol? Because those two get mixed up very quickly.
Yeah.
And as we're taking off, cortisol is that stress hormone. Dopamine is that like need for kind of adventure, that happy hormone, or the happy neurotransmitter. And I was like, okay, so what am I getting? I was like, definitely cortisol. And in a way, cortisol can be quite addicting because when we're feeling really mellow, we're almost like, should I be feeling something? Am I enjoying this feeling? But when we experience this cortisol high and this cortisol kick, it can be kind of that adrenaline, and then there's almost that need for more. And so,
Oh yeah, I definitely get that feeling for more.
yeah, and so I think that a lot of pilots, when they're not consistently flying, they almost kind of get this bug. So it's
Yeah, I call it the itch, the
yeah,
flying itch.
it's that
Yeah.
itch. And so it's okay, I haven't felt this cortisol hit and this high. And but kind of being on the outside of it, I'm able to have a bird's eye view perspective, saying, okay, well, I was raised with like this sort of reaction. Is it because of XYZ in my father's career? Or I've noticed my husband going from naval special operations, go from one way to thinking in a completely different way throughout all of his training. And yeah, I've gone, okay, well, they're training you to think a specific way. They're training you to be hyper-vigilant. I mean, that's a huge reason why so many military members decide to go into aviation. It's that hyper-vigilant
Traffic.
One
I'm
o'clock.
already kind of used to, like, we just heard traffic. Here, I'm actually going to take it off autopilot and kind of turn us around so we can get above these clouds. We had to do this the other day too. It must be a Texas thing, all these like popcorn.
So,
We look nervous.
oh my gosh,
Yeah, it makes the sky super pretty, but
yeah, it's gorgeous, but at the same time, the amount of canceled flights that my husband has driven to the airport for,
yeah, I believe it. So we were just talking about
yeah, like how I
the training for a mindset.
Yeah, so they're basically training you to be hypervigilant without the expectation to always have to be hypervigilant. So it's like you come home and you're saying, yeah, relax, you get 8, 10, 12, maybe even a few days off, like you're required, but you suddenly can't turn it off. I have to continuously be looking around. And it's not even for a safety perspective, even at home, because I mean, home is where's
Off here at 3 o'clock.
What FA tapes? Where? Did you hear that?
yeah.
What FA? Blah, 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 blah. I'll be looking for that traffic.
It went right to the club.
But honestly, the thing is that like with me when I am listening to cops,
Yeah.
like because I've had to drop my husband off on military bases, that is so normal to me. No, that's not it. Okay, but yeah, it's so normal to just hear FATs as if it were just another plane. And I was like, what? What are we supposed to be looking out for? Is that impressive?
Well, you don't typically see them every single day. And if somebody is pointing them out on cops, like, yeah. I did get to land before the Blue Angels one time. So I'm sure all of them were like, oh my gosh, look at this little arrow flip.
Or
Really?
you're like, this is where I started. This is my beginning.
That's true too. It could be that too. So why is mental health such a sensitive topic in aviation specifically?
Well, I think that there's been just a multi-generational stigma, but also misunderstanding about mental health. And so it's more like that invisible bone that you really can't see. So when you break your leg, it's going to be pretty obvious. Yeah. But when something's going on and you need something like physical therapy, like a ligament issue, maybe someone can't see it. Maybe you're just kind of struggling and pushing through the pain. But with mental health, there's that expectation to compartmentalize. And yeah, the problem is that when you're consistently compartmentalizing, there's going to be a moment where it just snaps.
Oh yeah.
And so maybe it happens behind closed doors and you're perfectly fine. And it's not going to impact your functioning as a pilot in the air, even just as crew. But overall, it's not something that anyone needs to go through. A lot of the time, depression isn't sadness being there. It's more of a lack of happiness. And so a lot of people will feel numb.
Yeah. Yeah. All right. One thing every pilot should stop doing immediately.
Ooh. The first thing that comes to mind is like excessive alcohol intake. Because alcohol is a depressant. And so
it also increases anxiety.
It increases anxiety. And so, like, yes, that is a touchy subject, especially with substance abuse being such a prominent thing. And I think that if that is an issue, then go to somebody who is trained the airlines and a lot of different workplaces that have pilots. They have programs in place to allow them to get that help so they don't lose their medical. But alcohol itself, it deteriorates the brain. It's at least used in more like of an excessive use. So like,
well, it's socially acceptable.
It's socially acceptable, so therefore it's okay in their heads.
But not really. You shouldn't be throwing back 10 shots.
No, and it's more of like how am I going to be seen if I don't do this? And it's like that, and then that creates more discomfort.
If your captain is drinking, you should be drinking too.
Exactly. And yeah, it's like a feeling that you need to almost be one of the guys.
Yeah. I tried that once. I did 10 shots in one night. I did not recover anything from that night. Never did it again.
And in a way, I feel that if we're not doing all the natural things that allow ourselves to feel more in control, then we're going to use alcohol to almost like use it as an excuse. So it's like somebody makes a mistake and they're going, oh, but I was drunk, as if like that's an okay.
And that's okay
for behavior. Yeah, and so not hard on anybody who may turn to substances. However, I do want to show them that there are better tools to use, and overall your body does feel so much better. Like your blood pressure will be lower, cholesterol could be lower. I mean, overall, all of these health issues that we're dealing with, like so many pilots deal with GI strain and issues. If we don't drink, then a lot of the time that improves as well.
Okay, yeah. I usually like to order tea, like chamomile tea with dinner instead of drinking alcohol. Yeah, good. Whenever something that I know is bad for me that I want to do less of, I just order tea. So it can't be bad.
Tea is my go-to. It is okay, fine. It's how I manage it.
Yeah. Hibiscus tea especially. That's my new aviation. Yeah. One habit that improves mental health instantly.
Routine. So pilots are notorious for being extremely strict, but like flexible routine. So like having the same routine when you get home as well as like getting to a hotel. So a lot of people are like, I need to unpack at some point, and then it's like taking off the uniform and putting on clothes before like normal, I want to say civilian, but like just normie
Civvies.
Yeah, civvies. Like just normal clothes to almost give your brain that moment of, okay, I'm all right. And then I'm no longer on the job. Exactly. And like sometimes, I mean, even if I have a really packed day, I'll just go in my room and I'll take a shower. And my husband knows, okay, I'm not going to ask her about how her day went. I'm not going to ask her if, she knows what she wants to do for the rest of the day. It's more so, all right, she needs some wind down time because maybe something was a little heavier. And yeah, hey, for y'all take a lot of mental energy doing this. And so you don't really realize how much mental energy.
You don't realize how much until you go home and you're like, and that feels really good right now.
Yeah, exactly. Yeah.
All right. If a pilot is struggling, talk to somebody or push through it.
I've always talked to somebody, even if it's not a therapist. So so many pilots have unions, and a lot of the guys that come and see me, they'll say, my union sent me to you.
Okay.
And a lot of it is because the union says, okay, you're going to be fine. We're going to protect you. We're going to make sure that you're not going to lose your medical, but we don't want it to get too far. Yeah. And so, yes, you can talk to peer support lines, but talk to anyone that you feel like you can trust. Don't talk to the captain that you just met who is on his third divorce. And
yeah,
I mean,
talk to somebody who knows you, who's going to look out for you.
Right. Somebody who could give it to you straight. I mean, that's not okay. You should not have to deal with this. You don't deserve it. Somebody who's going to treat you with the dignity and the respect that you are not giving yourself in that moment.
Yeah. Yeah. That's kind of heavy.
Yeah. I mean, think about it. If you're not talking to somebody and you're like, my pride is getting in the way, saying, I'm not giving myself the respect to say I deserve to not have to feel this way. Because a lot of people are embrace the suck. Especially during training and all that. But it's I don't have to feel this way when I go home. I don't have to constantly be thinking about that horrible landing that I did. You're going to have horrible landings no matter what.
Yeah.
So it's okay, you know how to improve. You're going to do better next time. But if you had a horrible landing and you're continuously ruminating on it, just constantly thinking, then it's going to bring that anxiety up.
Yeah. I hear what you're saying with that, but I also am still kind of leaning towards the embrace the suck, because you do have to be hard on yourself to get to the point where you can, those landings. But also, yes, you don't want to ruminate all night long, not be able to sleep.
It's
one landing.
Embracing the suck is you have to go through training. You have to go through the low time. Yeah, those low time jobs. 100%. And those are not fun. And honestly, it's probably where a lot of pilots probably drop off. Yeah. So yes, that does suck. But you don't have to embrace the suck of not believing that you're worth that time and energy that somebody's going to put into you, because therapy, you get an entire hour of just worrying about how you can improve and looking at your life as a whole and see different patterns of behavior that you might be able to break, and eventually that you don't have to pass and carry on to the people around you.
Yes, yeah. That's the biggest thing. You don't want to carry it around to everybody else.
Yeah. And so, yeah, it's
everybody's miserable.
Everyone should be, right? No, it's so
I'm miserable. Everybody has to be miserable. No.
Yeah, and then not asking for help, that's the pride getting in the way.
Yeah.
And so it takes a lot of courage to ask for help. And so I'm always, even just in 15-minute consults, even if a pilot doesn't choose me as their therapist, I'm so proud of you just for making that appointment. Yes. Yeah, it is at the right, but
researching somebody and calling them up and 100% is a struggle in it.
I mean, I see thousands of people on my website and then only a few click. And I was like, all these people, they could be going, okay, what's this chick even standing for? What in the world is aviation mental health? It's how can I discredit this? But then it's the people who are going, oh, I might need this and I might really want that extra support that might actually optimize my life. Yeah.
And improve your life.
Yeah, 100%.
Hey guys, thank you again for watching. Make sure that you subscribe, and comment. I really appreciated all the engagement on the last video. I love reading your comments. I love responding. So please, please, please comment more. You guys actually gave me like a couple of ideas for videos too, so thank you so much for that, and stay tuned for the next one.